I think that there's real value to having a specialty team that is focused on palliative care, and for a couple of reasons. First of all, I feel that a palliative care team is about building a relationship and having, in some cases, a short relationship, and in some families, in some situations, a very long-standing relationship. And continuity is so incredibly important for these families, for these patients, that not having to start from scratch every admission or every conversation is so important, to be able to pick up from the last conversation with that mutual understanding is really critical. I think our medical system is divided so that we're divided to be as efficient as possible. It's not to say that that's the best way, but we're divided to be as efficient because you have a specialist in this. You have a specialist in pulmonary, specialist in neurology, a specialist in orthopedics. And those people are really focused on their piece of the puzzle. But a child with complex medical needs is a puzzle with many, many different pieces. And palliative care is one of those amazing specialties that helps to bring those pieces together so that you can look at that bigger picture. Because if you look at a puzzle piece, you see just that, and that's your perspective. Whereas a palliative care team is so vital to saying, let's put the pieces together and see what it looks like. What's the bigger picture here? And I don't think you can expect that to be integrated into all the specialties. I think it's good to have all the specialties have perspective, but they're never going to have the perspective of the palliative care team or a primary care provider. I think sometimes a primary care provider is able to fill that role as well. It's not that it's necessarily someone who is on the designated palliative care team, but it's someone who has the awareness and willingness to first listen and really hear what the family's perspective is, what their experience is, what their understanding is, and what their hopes are. And sometimes that's the primary care who is able to really fill that role. But I think that the more that our medical system is stressed and forced to be efficient, a 15-minute visit is not a palliative care conversation. So if anything, I think we need more palliative care teams and people who have that focus and experience to provide that support to families.